Good evening and thank you for joining us for the eReferrals to the Southeastern Sydney Local Health District webinar. Due to developments beyond our control, the presentation regarding virtual fracture clinic at the Prince of Wales Hospital could not proceed today, for which we sincerely apologize. My name is Alex Dolezal and I am the Digital Health and Quality Improvement Team Leader in Central and Eastern Sydney PHM. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize their continuing connection to land, water, and community, and pay respect to elders past and present. I'd also extend that respect to any Aboriginal colleague who might be joining us tonight. I'd like to introduce tonight's speakers. Arun Subak is the Project Manager, Digital Health, Southeastern Sydney Local Health District. Siddharth Ramani is the Project Manager, Engage Outpatients, eHealth New South Wales. Lauren Bosco is the Health Pathways, Southeastern Sydney Manager, and Jean-Christophe Menier is the National Manager, Health Services, HealthLink. Thank you.
Alex said, my name's Arun Subhag. I'm the LSD project manager, and I'm presenting along with Sid and Lauren, and we're covering off electronic referrals at Southeast Sydney. I think some may be familiar with this slide pack because we've been presenting on eReferrals across a few webinars since middle of last year. So some of this content may look familiar, and I'll try to recap where we need to cover off just the background. So in terms of background, Engage Outpatients program is a new statewide solution to improve the e-referral experience of patients, referrers, and clinicians in outpatient services. It's a Ministry of Health sponsored initiative. Engage Outpatients program consists of two solutions. The first one is Electronic Referral Management System, which is called eRMS, obviously abbreviated, and this is a hospital-based system for receiving and managing referrals. The second component is called eReferrals, and these are electronic forms that can be sent directly to the eRMS system from referrer practice systems or My Health Link portal. In terms of just the detailed definition of an e-referral, so it's an electronic document that can be sent securely, replacing other methods such as faxing or posting paper referrals. Referrers and patients will also receive notifications on referral outcomes. Some may be familiar with this process overflow. So this is a solution overflow in terms of just the process that takes place. So on the left column, this is all the GP practice systems where you can access the HealthLink forms. So essentially the GPs fill out the forms. It is sent securely via a secure message to the eRMS solution. The middle component, the green component, is the eRMS solution, which is the hospital-based solution. So as part of the workflow, the admin staff receive it, screen it, obviously review where, if it's got a named referral, where it's to go to, then that is referred to the triaging clinician. The triaging clinician goes through their process of reviewing all the attached documentation and then triaging the patient appropriately. Once they've completed their process or their work activity, it goes into the post-triage process component, and this is where the admin staff obviously review it and make sure that there's appointment made according to what the triage categories are, and basically close off the process. The bottom part of it is where I mentioned the notifications to the patients. So once we have received it, there's a notification process to the GPs and the patients. And then once it's closed off in terms of the post-triage component, there's also a notification process. And overall, once the whole process is completed as a work activity, there's a e-referral encounter into into EMR. So in terms of key benefits for referrers and patients, there's obviously improved patient experience through notification process. There's better visibility of services. So all the referring clinicians can see the services that they can refer to. There's a faster processing triaging of referrals. There's notifications to referrers and patients on the referral process that I mentioned before. There's obviously reduced lost or misplaced or misdirected referrals in the paper-based processes. improve quality of referral information. We save time on manual paperwork and processing fax referrals. And obviously there's a faster intervention and better health outcomes. In terms of the referrer activity to July 2024, so on the left image, we went live in centralized outpatients at Prince Wales around the beginning of November. So that's basically the trend moving forward. Then we started an expansion project which covered a greater number of services. And basically, as you can see, there's that number of sites that are referring in to June. And the next image next to it on the right-hand side is basically the overall process or progress in July. So as you can see, we've gone from, say, 270 odd to about I think the latest stat is about 380. So that's a great progress in terms of the number of referrers referring into our services. Just a little note there, if you submit an e-referral, they're usually screened within 24 to 48 hours with notifications sent immediately, and e-referrals are definitely our preferred method of referrals coming in. In terms of feedback and quotes from GPs, this is some of the quotes we've received. So from Dr. Annabelle Kane from Esconville Doctors, essentially she's basically implied that it's an easy solution to use because they already use HealthLink for the driver's license assessments and My Aged Care referrers. So this is a functionality that they're quite familiar with. So it's basically a bit more of an add-on. Other GPs have said basically it's easy to use in terms of the e-forms filling component. It's very convenient. eReferrals is free, easy, efficient, and user-friendly tool. So that's some of the commentary that we've received so far. In terms of the outpatient services accepting electronic referrals at Prince Wales, those are the services so far that we've expanded to. So there's quite a large number of services. Most are associated with the centralized outpatients, and we've added on diabetes, respiratory, and physiotherapy this year. Other sites that have gone live are Sutherland Hospital and the Royal. So with Sutherland, we've got all those services. That's again focused mostly on centralized outpatients. And for the Royal, we've got those services that we're receiving e-referrals. And there's basically, we want to make sure that there's almost zero faxes wherever possible, because e-referrals are such a large benefit to the organization and to patient care. I'll hand this slide over to Lauren, who'll cover off the health pathways. Lauren, are you there?
Yep. Thanks, Arun. So we just wanted to show you, if you are using eReferrals via your health pathways page, just to demonstrate that we have worked closely with the project team to integrate the link directly into the pathways for the participating services. So you can see in the green box, we've got the link there, and that eReferral is accepted and the preferred method. They sit under a rolled up box under services. So you can see Prince of Wales, that gray box will be rolled up. And so you will see HealthLink under those participating services, as I mentioned. In the red box, you can see information for referrer. So there are alternatives if for some reason the service isn't working or you do need alternate options for your referral. You can see the administrative contact information below for other options. And on the pages that are, again, relevant for the statewide referral criteria, those have been embedded as well. So it should, all the information that you require should be available on the page as we continue the integration.
Thanks, Lauren. Next slide onwards is covered by Sid Ramani from eHealth. Sid, are you online?
Yep, I'm here, Arun, just working out how to get off mute. Good evening, everyone. I might just share my screen and take you through the demonstration. I think, Arun, will need you to stop the presentation and then I'll take over. Bear with me. Screen 2. Okay. You see my screen? Oh, thank you. All right, so I just want to give you a demonstration of the new feature that we've got. I'll cover how to make a referral using the HealthLink smart forms, as well as the demonstration of the referral update feature that we've released. Just for background, referral update feature is where you can either respond to a request from the LHD, from the clinic itself, or you can notify the patient circumstances may have changed. There might be urgency, or the patient may want to cancel the referral because they no longer require it. They're feeling better. So in any of those circumstances, you're able to send updates. You're also able to ask questions and respond to questions that may be coming from the clinic, and use that referral update feature. On the screen here, you can see that I'm in Medical Director, logged into Medical Director. I'm logged into the patient EO test. And for the then I go to the HealthLink tab there, and I click New Form. This will take us to the HealthLink landing page. Obviously, this is a test system, so your production environment won't be quite as busy. You'll see fewer links. And to make referrals into Southeastern Sydney, you click on New South Wales Health Outpatient Referrals, Southeastern Sydney LHD. Once you do that, you can see all the services that are currently live with Southeastern Sydney. And then for the purpose of this demonstration, I'll show you the Royal Women's Hospital Antenatal Booking Clinic. So you make a selection of the clinic, you make a selection of the hospital. In this case, there's only one, and then you click Continue. This launches the form, and while that's launching, it's pulling all the relevant clinicians associated with that clinic, and that's populated, as you can see here. If you know any of these clinics, you can make the named referrals. I'll just quickly give you an overview of all these other tabs here. So requested information tab is the tab that you have most of the interaction with regards to the referral. The other tabs all help pre-populate and pull through attachments that may be in your practice management software. This one pulls all the attachments. This one pulls the medications, allergies, and alerts of that particular patient. This one pulls the medical, social, family history, and then patient information, Medicare details, next of kin, contact details, and so on, and then referrer information as well. All of this is to ensure that you have, swift user experience, to complete the referral in a fast manner. Back to the requested information tab. So you can see all the mandatory fields denoted by a red asterisk there. So if you don't complete any one of those, the form will warn you or stop you from being able to submit until you've completed those selected fields. So in this case, we'll just pick the first clinician, Wendy Hawke there. Referral date is defaulted to today. Referral type is new or continuation. And you can see here in red text, it calls out that if you want to make an update, navigate to the update tab, which I'll take you through a bit later on in the demonstration. Referral period is defaulted to 12 months. You've got the option to select 3 months or indefinite. Referral urgency, because this is an antenatal referral, urgency is defaulted to 30 days. You can make other selections as required. And then if patient is available for short notice, if the patient is suitable for virtual care, and health pathways, as Lauren highlighted earlier, is integrated here. So you can click in and the health pathways page will launch specifically for the antenatal clinics within Southeastern Sydney LHD. Reason for referral, you can select the reason for referral, and it'll populate all the supportive information that's required for that particular reason for referral. And you can see here all the required information, if appropriate, that needs to be supported with this referral. There's a question here that asks if you have completed all of it, and if for whatever reason, if you think some of the requested information isn't available, you could select no, and provide that reason as to whether it's not relevant, or if it's not available, or if it's been ordered and you're waiting on that particular information. That helps the clinic understand, where the referrals, where the supportive information is at, to be able to triage and progress the referral in a swift manner. Then we come, I'll just fill this out so that it'll allow us to progress. Then we come to referral details, where you can load consultation notes from the practice management software. We'll just include that for the purpose of the demonstration. And you're also able to edit after you've added whatever consultation notes. So you can continue to edit and add more. So there's a 4,000 character limit. So you've got 2 boxes to provide a lot of the information required. And then preferred models of care. And if the baby is going to be Aboriginal or Torres Strait Islander, if applicable. And then the mandatory fields for the antenatal referral. If in a rare cases, EDD, expected delivery date, is undeterminable, you can select that to progress. And this is defaulted to yes, so that it prompts you with all the pregnancy complications. If there are none, you can select no. And then all these other considerations to risks and barriers to access are defaulted to no. If any of them are applicable, when you make a selection, it will prompt you for further information. And then the patient consent. So this consent is the consent for the exchange of the information electronically between HealthLink and the New South Wales Health systems, and also consent to being contacted by any of the noted contact methods, whether it's SMS, phone, email, or mail, as selected in the patient record. So with that, with all the mandatory fields completed, you can see here, we'll try to do a preview and see if we're able to progress the referral. Oh, something else is happening there. Let me actually try to submit. So essentially, the preview screen would have brought you to a screen like this, and then you could press submit. But in this case, we've submitted it, so you can see what the clinic will see, a full view of all the information that you've attached. And this now means that the referral's gone to the LHD. So I'll just quickly show you the referral update feature. So we go through the same process, go to the HealthLink tab, you go to new form. The key difference is, instead of going to make a referral tab, you go to update referrals tab. And when you launch this, it automatically starts to search by the date range noted there. And once you click that, it'll tell you if there are any matching records. Just a note that because this is a test environment, you're able to see Tasmania Health. Unless you're a GP in both Tasmania and New South Wales, you won't see Tasmania Health. You'll just see the New South Wales Health. And this is just loading, so we'll just give it a few seconds. So here you can see that for that particular patient, EO Bellamy, Dr. Bronwyn Gillespie, the test doctor, has submitted all of these referrals. So they're able to, make an update. This button here allows you to make an update. This button here allows you to view the history. This button here allows you to view the actual referral content. So what we'll do is we'll quickly just view the referral content there. So this is the most recent referral that was made. for the particular patient. So this is the one that I think I've actually made just then. And you're able to see the status. In this case, it's just received. And just a note that it's not a version of the referral, it's a version of the status that comes back from ERMS. So in this case, it's just saying that the referral's been received on the other end. So that's pretty much an automated notification that comes back. And now let's just assume that we want to make an update for this particular referral. You progress that, you click on that button, and the update form launches, as you can see. So here you're able to either request a review of the priority, or provide a response to an information request, or request a cancellation, or provide any other reason, and then there's a short text field there to signify what the other reason is. So we'll just say we're responding to a information request. Please find attached. And we make an attachment. In this case, we've got some letters here that we can attach. So we'll make that attachment, and then we'll progress to preview it. I'll just progress to submit. I'm not sure what's happening there. So we'll progress to submit, and you'll be able to see that you've made a referral update for that particular patient. Now, if we go back in, I'll just close this and relaunch the update feature, so we can see the history there. So go back into update referrals. Might just take a few seconds to load. So if I now go into the history there, you can see that the response to information request that we've just made is seen here. So as the referral traverses through the different statuses, let me see if I can find an old one. So we can have a look at one of these. It'll show you what state it's gone through. It'll show you, how the referrals progressed, and if there are addendums made, or if there are updates made along the way, you'll be able to see all of those in here as well. So that kind of completes the referral update feature. I do want to call out that you'll be able to see in your communications, you'll be able to see then all the notifications that are coming back, and any requests that have been made by the LHD. You can see them in your notifications. So I've got them filtered for this particular patient just over a month, so that we can see a few different notifications, and you'll see what the notification is about, which clinic has accepted it, and if in some cases there might be referral on hold, and they may be asking for additional information. See here, need lab results. So you can see that information and make a response like we just did, using the update referral feature. So those are the key features that we wanted to do as part of the demonstration. Arun, I'll hand back to you for the slides, so we might pick up the rest of the information, the rest of the presentation from there. So I'll just stop sharing. So if you don't mind sharing the slides, we'll go through that.
Again. Did you want to pick it up from here, Sid?
Yeah. So as we called out, you can access it from Best Practice Medical Director Jeannie, and there's a few more that are compatible. You can see all of those in that website there. And you can, if you got a practice management software that isn't compatible just yet, you can use the HealthLink, My HealthLink portal, from where you can make referrals still. And then the HealthLink smartphones are free of charge, and there's no cost involved to be able to make eReferrals for yourselves. Next slide, please, Arun. We've touched on this, so you can respond and make referral updates in response to additional information requests that come from the clinic, or a change in patient circumstance. Next slide, please, Arun. We've completed the demonstration. This is a good one to note. So we saw in the notifications features there, within your correspondence, you'll get notifications for all those green ticks there. Upon receipt, the notifications are sent back automatically. We saw that in the demonstration. If the referral's put on hold for whatever reason, if there's a request for additional information, you'll see that notification come into your correspondence there. Any ad hoc messages, you'll see that in your correspondence. Screening outcome, if the referral's not accepted, you'll see that. If the referral's accepted, it'll progress to the next step, so there's no notification at that stage. So that's an internal status progress. So you'll see that in the referral history, but there won't be any particular notification for that. If the referral's redirected for whatever reason, if the clinic determines that the care is better provided at another clinic, then you get a notification, and so does the patient. And if the referral's reassigned, that's an internal reassignment from one clinic to another. There's no notification in that stage. If the triage outcome is accepted or not accepted, both of those go to yourself and the patient. And if the referral's cancelled, withdrawn by the patient, withdrawn by yourself, unable to contact the patient, or referrer did not respond if there was additional information request and wasn't responded in a timely manner, there'll be a cancellation. So essentially you get all of these notifications within your correspondence. So you got a kind of like a one-stop shop where you can see the progress of the referral through the different states, and also be able to have visibility of where the referral's at those different states. So if you want to go to the next slide, thanks, Arun. So some of the feedback, since we've got about 380 practices that have been submitting referrals, some of the feedback that we've got from the usage is around some practices have the name coming through as main surgery. So in the practice management software, particularly in best practice and medical director, there is a location in the practice setup from where the name is being pulled as main surgery. So if you could review your setup, and we'll send you the particular guide to be able to do that, whether it's in best practice or medical director. Screenshots of how to do it step by step. We'll send you the guide, and that will help us, get correct information both from a reporting perspective and being able to contact the practice in a clear manner. Because main surgery doesn't help us be in terms of being able to differentiate from which practice that referral is coming from. So this will really help us if you could review that setup there. So another call out is patient identifiers in attachments. In some cases, the test attachments that come through are missing the patient header information. This is because of a feature within the practice management software, medical director and best practice in particular, where the checkbox is unselected to include header information. Again, we've got the PDF guide there in that link, and we'll share those links for yourself to be able to go ahead and update that. So you'll be able to please check that setting and ensure that the header information is included, because it's critical so that we know that the right patient information was attached to that particular referral. we can avoid any clinical risks that may come out of not having that header information. We also request, please, if you could ensure as much as possible providing all the supportive information that's noted in the referral, so that the referral progresses through quickly and results in better patient care. So where the GPs have been attaching referrals, the completeness of the referrals help us progress it swiftly, through to the next stages. And results in better patient care. So we please request you to ensure that you provide as much supportive information to the referral so that we can do that. And in some cases, we can see that the leading in your provider number, if there's a leading 0, just please ensure that that leading 0 is updated in your practice management software so that when it pulls through, we get that accurate information and it doesn't hold up the referral once it hits the clinic, so that the LHD can progress it swiftly. So yeah, just a few key call outs that help us provide better outcomes both for yourselves and the patients involved. So that's that slide. And yeah, we've got a number of different resources that are available for your consumption for further information. So there's the Southeastern Sydney website, which calls out all the services that are currently live that you saw on the slides. The eHealth New South Wales website that calls out pretty much all of the LHDs alive and any other features that are coming up. That's a good resource as well. And the Health Pathways page, Lauren touched on that. So that's also a great resource, as you always have used it, and we keep that up to date in line with the clinics that are going live. And there's, the communications that we work with the PHN closely to send the information out. So a big thank you to the PHN. And as noted, we've got best practice, G&E, medical director, medtech, SHEXI and ZMed that are currently compatible. As more and more practice management softwares become compatible, you'll be able to make referrals, in a more integrated manner. Otherwise, you've got the My Health Link portal in the meanwhile to be able to make electronic referrals submitted there. And key contacts from the project, Arun, do you want to touch on this part, Arun?
Yes, so key contacts are myself for the moment until we move on to other projects, and Christian, and obviously Sid from eHealth. We expect that once we've obviously finalized this stage of rollout for those services, and we're pending further direction in terms of further rollouts for the LHD in terms of other services. That's still work in progress. And as for contacts at this point in time, I'd be probably the easiest to reach and Christian for a short period until we give you further advice on our website. And I think that's the end of our discussion. Alex?
Well, thank you, Arun. Thank you, Sid. Thank you, Loren. I would like to say that the question and answer session is now open. And I have noticed that there's a number of questions which I will read, and one of you can answer. So I do have a question. What methods are used to update the GPs on the outcomes of the clinic visits?
That's probably... No, I was going to say that's probably just the standard practice after the clinical visit. That stays as BAU. There's nothing too different with the system. Sid, is that fair to say?
Yeah, that's correct. So along the way, you saw the notifications coming back. But once the referrals, once the patient's been seen, the same outcomes that currently go out continue. So you get the outcomes via HealthyNet. That sort of continues. That process continues.
Thank you, Sid. There is another question. Is there an option when requesting the doctor to have the next available physician?
No, the answer to that is the appointment process is separate to the system that we've got here. So we're not able to see just yet the availability of clinicians. So what the clinics do is they can. So if you pick a particular physician and they're not necessarily available, when the referral gets to the clinic, they'll make the assessment of which clinician's available and update that. Arun, sorry.
Yeah, I was just going to add, that's usually the admin staff leads that, because sometimes obviously we've got occasions where the particular triaging doctor is obviously away or not available. So then they manage who's the next available for that service that does the triaging component, if you're talking about the triaging, what's called component.
Yep.
Is there any,
Thank you.
Alex? Yep.
I've got another question. How can practice nurses get online access, in brackets, maybe via health pathways, to be able to follow up on the GP referrals to make sure they are received and actioned?
How
Is that a
can
Sid question or is Jean?
I can read it
question?
again if you want
Yeah.
me to. So how can practice nurses get online access, in brackets, maybe via health pathways, to be able to follow up on the GP referrals to make sure they were received and actioned?
Yeah, I did write an answer in that Q&A there, just around the notifications process that Sid outlined. So there is quite a comprehensive notifications process that will go back to the referrer, and that will typically go back via the secure messaging pathways into whatever of the various clinical software systems that are being integrated. So that would be, again, the same process, where you would go and find any patient reports or results, discharge summaries, etc., that will be coming through routinely into the practice software via those various organisations. So the notifications will still go back through that same path. It just needs to be reviewed. If the practice nurses don't have access to those areas to review those patient details, then they just need to be in touch with the practice manager to make sure that they can get access to those to double check.
Thank you. Another question. If a referral is redirected, does that mean we have to submit a new referral to the new clinic? What is the difference between redirected and reassigned?
Yeah, so on a case-by-case basis, it varies. So I'll start with the differences between redirected and reassigned. So redirected is essentially from one facility to another. So let's say you're referring to Prince of Wales clinic, and that clinic may not be able to provide that particular care. So they might redirect the referral to Sutherland. So you get a notification if that redirection's done automatically by the clinic. In some cases where the redirection is not possible from a systemic standpoint, so that other clinic, the other clinic they want to refer to is not on the system just yet, then the redirection will be manual. So in that case, the referral will likely be rejected, and you'll get a notification of the rejection saying that's not been accepted in this case, because that that care was not able to be provided. In terms of referral reassignment, so that's just a reassignment from one subclinic to another. So that's just an internal reassignment. There's no action on your part. Hope that answers the question. There's a little bit of complexity there.
Thank you, Sid. Another question. If you don't get an acknowledgement of referral, what do we do?
That's a great point. So if you don't get an acknowledgement, so we have checks and balances in place in terms of monitoring the messages going in between the systems. So if you don't get an acknowledgement, likely we would have caught the error, and we will follow up. either from an e-health perspective or the clinic perspective. But if you don't get an acknowledgement, the best action is to also follow up with the clinic themselves that you referred to, so that you can double check, and that may spur or speed up the investigation that may be happening side by side.
Just on that, Sid, is there a alert that the GPs get on their practice system if there's technical issues where we don't receive the referral? Do they get a highlighted, I don't know, prompt saying it hasn't gone through?
Yes. So if there is a technical failure, and for whatever reason the message didn't go through, there is a rejection message that goes back to the GP saying, yep, there was an attempt made to send it, but that didn't work for whatever reason, and your referral's not progressed. So you'll see in your notifications, the same place where you saw received, in your notifications, you will also see a negative acknowledgement to say that referral's not progressed. So then you may have to follow up with the clinic and either look at other means of sending it or retry the submission. So the outage or the issue may be intermittently affecting your referral. So you may be able to retry. Otherwise, if the retry doesn't work, then you might have to send the referral via other means.
Thanks.
Thank you. Another question regarding antenatal referrals. As new results are received, for example, ultrasound reports after patient has already been accepted into the system clinic, can GPs update with the new result reports to spare printing and providing to patients?
Yes. So just to distinguish, there's a bit of nuance there. If the referral is completed, you won't be able to send the updated information. If the referral's in like any other state other than cancelled or completed, you will be able to send the updated information using the update feature. Where it's completed, the best way is to just send a new referral, so that on the receiving end, the clinic will be able to see that there's a close relationship between one referral and another, and they'll be able to merge them on their end and update it in a systemic manner. Hope that answers that.
Thank you, Sid. Now there's a couple of questions here which are touching upon the same topic, and that's when will St. George outpatient HealthLink forms be available?
Okay, that's probably a question for me. So in terms of St. George services, obviously that's a big facility that's missing out of our scope at this point in time. There's a number of reasons at this point in time why we haven't included them. One is obviously we have a number of prerequisites that need to be met in terms of preparation for this system. St. George is working through that at this point in time. Plus they've got additional challenges around the new build, the Kensington Street building where the outpatients clinics are going to be provided, so they know what to do in terms of the preparation work. We're just lacking the time, the resource at this point in time to complete them.
Thank you, Arun. There is one additional question, or it might be a comment, about that the eReferrals is increasing the admin workload on the GPs.
Yeah, I guess, yeah, to just note that, the feedback overwhelmingly has been that it's made things easier, more traceable, more trackable. The pre-population from the practice management software makes it easy for you to maybe, make the referral while the patient is there. As you saw, the referral probably took me 4 or 5 minutes if I wasn't doing the demonstration to click through, and 99.99% of the time there's successes. We've processed 38,000 referrals, and we've had very, very few failures. And where there are failures, we've been able to go back and address them in a different manner. So we really, the feedback that we've got from all the GPs using it is that it reduces the burden, but happy to take any feedback and see how it can be simplified further.
Thank you, Sid. The last question I have is, if a referral has been received, the only way to add new reports is to complete a completely new e-referral?
Very good question. So in a received state, you can add updates, no problem. The only two states that you can't add updates are cancelled or completed. So for received referrals completely processed from the clinic end, you'll see those statuses. It will stop you. It will prevent you from being able to send an update. And in a cancelled state, for whatever reason, if the referral is rejected, you won't be able to submit. But in every other state, so received, screened, triaged, all of those states, you will be able to send updates to that referral, and the receiving clinic will go to the workflow and update that information, as that's critical in a lot of cases. Where there's additional information that'll help.
Yeah, Sid, I might add in there as well from HealthLink's perspective. So the system itself in your practice software will have all your previously sent information as well. So if you have previously sent that referral and it's been completed in terms of New South Wales Health's state, but you still need to send more information, sending that new referral, as Sid outlined, will go straight back to that clinic, won't go anywhere else if you select the right clinic to send it to. But you can also send and attach the previously submitted referral, because you've got it in that patient record against that that form. So that should all then go and provide New South Wales Health with clarity around what it is that you need to provide. That's really important for that patient.
Thanks, JC. I've got one more question came in. Does completed mean they have been seen or booked in?
Yeah, good question. So completed essentially is when they've accepted the referral and booked it in. So that from this system's perspective, because the appointments is still sort of the current process that's being followed. Appointment sits outside of the scope of this. Yeah, once it's booked in, that referral's completed. So in those cases, you will have to send a new referral.
Thank you. I don't believe there's any more questions, so I will give the attendees opportunity of, let's say, additional minute to type in any additional questions, because we still have time. In the meantime, Sid, can you mention the size of the attachment? That was one of the things that came up in the past.
Yeah.
If you're attaching, let's say, scanned correspondence from inside your clinical software, from the documents or the correspondence in, what implications it might have?
Yeah, so there's a 5 MB attachment size limitation. However, you're able to use the update feature. So some attachments may be quite large. So either you can compress the attachment if that's easy enough to do, or send the attachment as a subsequent referral using the referral update feature, and send the referral, send the attachment through in that way. The 5 meg limitation is to in along the pipeline. There are multiple systems that have varying attachment size limitations. So that's to prevent anything failing along the way. So the workaround there is to either compress the attachment or send it in a subsequent referral.
Thank you, Sid. There's 2 more questions which came in. One of them, I believe, was already touched upon before, which is there an option to choose first available physician instead of naming a specific one?
No. So the first available. So if you make a selection of any clinician, the clinic will be able to assign it to the first available themselves. They'll be able to move that around if that particular clinician or physician isn't available. So that works out in that way. If not, in the bottom of the referrals referred to options, there is an unnamed referral. You can make that selection, and that works also the same way. That's in compliance with the Medicare, private and public patient access.
Thank you, Sid. And the next question is, and it's actually two questions, but I'll probably present it as one. So does the system show exactly when the appointment is, and can we see the outcome of patient visit and results online?
Yeah, so appointments are out of scope. So this system doesn't capture appointments. Appointments will follow through the current processes. Whatever way the communication you've been receiving about appointments, that will continue. And in terms of the patient outcome, also current processes. Because once the referral's booked in or processed, that sort of leaves the ERMS system. It goes back into the hospital EMR and the clinic EMR, and the current processes for viewing the referral outcomes and viewing the appointment outcomes is all sort of managed through the current processes, whatever you're receiving now in the way of communication in that regard.
Well, thank you. Thank you, Sid. Thank you, JC, Arun, and Lauren. I believe all the questions were answered. So
Thanks, Alex. So just in summary, I'd just like to make sure that we've got a statement in terms of have a look at the number of services that are obviously available, because we haven't had the ability to cover off all the facilities. So obviously this slide pack and our website's got all that information, and underlining again, for those services, our preferred method to receiving referrals is eReferrals. Okay, thank you.
thank you, Aaron. So just to conclude, I would like to thank the speakers and all attendees for participating in tonight's webinar. I would like to remind you to complete the online survey that will pop up in your web browser. You will get some additional resources as promised, and we look forward to seeing you online soon. Good night.
Thank you.
Thank you
Good
all.
night.
Bill.
Good night.